All right, let's get right into it. In this explainer, we're tackling a super important clinical moment. You've just found a breast cancer. So, what do you do next? We're going to break down the practical steps of sonographic staging, and we'll cover the key signs and rules you absolutely have to know. So, this is the big question, right? Once a cancer has been identified, the very next step isn't treatment, it's staging. Staging is what tells us the extent of the disease, and that's absolutely critical for figuring out the right plan. It's kind of like a diagnostic quest, and it all starts with ultrasound. So, where does this quest begin? Your first move is always the same. You have to ultrasound the patient's armpit, the axilla. Seriously, this step is completely non-negotiable. Before you do anything else, you have got to check out the lymph nodes in that area. And why is this so critical? Because about 1 in 3 times, 1 in 3, you are going to find abnormal nodes. That's a huge probability. It's not some rare thing, which is exactly why this step is such an important part of the whole staging process. Okay, so you found some abnormal nodes. But wait, your work's not done. The next crucial question you have to ask is why they're abnormal. Are they involved with the cancer we just found? Or could this be something else entirely? Maybe a systemic issue that has nothing to do with it? This is where the real detective work begins. Your first big clue is simple, but it's really powerful. Is the problem on one side or is it on both? So if you see abnormal nodes only on the same side as the cancer, that's unilateral. You should be very concerned that the cancer has spread. But if you see it on both sides, bilaterally, well, that's when you start thinking about systemic causes, something affecting the whole body. Let's say you're leaning towards cancer. The next major decision you've got to make is whether or not to biopsy a suspicious node. And thankfully, there's a really clear framework for this, and it's all based on 3 key features you can see on the ultrasound. Think of them as your red flags. So here they are, the 3 features you're hunting for. First, look at the cortex. That's the outer layer of the node. Is it thickened? Anything over 2.3 millimeters is a major warning sign. Second, has the node lost its normal fatty center, what we call the hilum? And third, are its outer margins irregular, kind of fuzzy? Any single one of these should make you suspicious. Now, of those 3 red flags, this is the one to really focus on. The loss of that bright, fatty center is considered the most specific sign for malignancy. So if you only see one suspicious feature, and it happens to be this one, you should take it very seriously. It's a powerful clue that the node is involved. Okay, let's move on and see how all this stuff fits into the official staging system. I know it can seem a bit like trivia night with all these different levels and names for nodes, but there are some really simple rules that make it way easier to understand when it comes to planning treatment. Here's a little cheat sheet to make it simple. For practical purposes, level 1 and level 2 axillary nodes, they're treated as being in the same category. And those little rotor nodes, the ones found between the pectoral muscles, they're just staged as level 2. And finally, the higher up nodes, level 3, and the supraclavicular ones, they also get grouped together. This really helps make treatment planning much more straightforward. All right, now for a really fascinating part of this whole thing. Even when you have all the rules down, you have to be on the lookout for a couple of classic imposters, situations that create abnormal-looking nodes that have absolutely nothing to do with cancer. Let's look at these sneaky mimics you need to be able to spot. So the first imposter actually comes from a little piece of medical history. A long time ago, rheumatoid arthritis was sometimes treated with something called chrysotherapy, which is literally therapy using gold. And that gold, it can get deposited in the lymph nodes. What's so cool about this is the classic appearance it creates. It's what we call an Aunt Minnie picture. And what that means is it's so distinctive that once you see it, you should instantly know what it is, just like you'd recognize your Aunt Minnie. You'll see these very dense, bright calcifications inside the node. That's not cancer, that's gold. The second major imposter is much more common these days, and it's all related to breast implants. You see, silicone from a leaking or ruptured implant can actually migrate to the axillary lymph nodes, and it causes a reaction that can look really suspicious on an ultrasound. And this gives us another fantastic Aunt Minnie sign. The silicone inside the node creates what's known as a snowstorm appearance. It's this very bright, echogenic, almost chaotic look that completely hides the normal structure of the node. So when you see this, you should be thinking silicone, not metastasis. Okay, wow. We've covered a lot of ground, haven't we?
We went from that very first step to the red flags and even the classic imposters. So let's try and boil it all down into a simple, practical checklist you can use.
So, here it is, your staging checklist. 1. Always ultrasound the armpit. 2. Use the 3 red flags, that thick cortex, the lost fatty hilum, and irregular margins, to help you decide on a biopsy. 3. Know your note level groupings. And 4. Watch out for those 2 classic imposters, gold and silicone.
And we'll end with a pretty memorable line from the source material. We all know gold is getting old. It's a fun reminder that even though gold therapy is rare now, recognizing its appearance and that of silicone is just timeless clinical knowledge. Thanks for watching.